I am Tu Kim Lam. Welcome to the Medical News. In this edition of the Medical News, we will talk about gallstone, which is the most common disorder affecting the body biliary system. According to the U.S. News Health, in the United States, estimate about 10 to 15% of adults have gallstone. About 1 million new cases are diagnosed each year, and over 800,000 operations are performed to treat gallstone. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will let us know the information about gallstone and the update news. Please join me to welcome Dr. Tran.
Hello, welcome to our show again, and hello, Mrs. Lam.
Dr. Tran, before we talk about the gallstone, first of all, would you explain to our audience what is gallbladder and what is its function and where it's located in our body?
This gallbladder is quite important for the body. If you look at the screen, you can see a green sac. That is the gallbladder. The function is to store the bile. Now, the biles were released and produced by the liver, and it will be stored in the gallbladder. And then whenever we eat a meal with fatty food, then the gallbladder will contract and release the bile, go to the intestine to help the digestion of these fatty food. This is mainly the function of the gallbladder. Remember, the gallbladder is a sac to store the bile. The gallbladder doesn't really produce the bile. Mostly is from the liver only. So this is very important to remember.
So what caused the stone? What formed the stone in our body?
This is the most difficult part of the study, because we need to know exactly what really causing the stone. In order to do that, it's more than the expert, they study what kind of stone that usually the surgeon or the physician had to deal with. Mostly, they can find that the cholesterol is the key element of the stones. The second group of the stone is called pigment stone. Usually, the colors is very dark and black. And they found that really the pigment stone contain a lot of bilirubin. Bilirubin is one of the substances released by the liver as well. The third group of stone is a combination of cholesterol, pigments, and calcium. Now, when they tried to explain why is cholesterol able to form the stone, they found that really in the gallbladder, there's two other substances that keep the cholesterol in the solution. It's not really able to form, to really concentrate or to form the stone. The first substance called bile salt. The second substance is called phospholipid. The three get together will keep the cholesterol in solution. So therefore, it doesn't matter how much cholesterol in the bile, they will keep in solution and not able to forming a stone. Now, when the bile salt is low, or the body cannot really keep up with the bile salt, the concentration of cholesterol will increasing and forming the stone. That belongs to the cholesterol in the stone. Now, for the other pigments, usually when the concentration of bilirubin increasing, they increase the risk of having pigment stone. The third group is the mixed group, usually triggered by infections of the gallbladder by bacteria. When the bacteria go from the intestine, go to the gallbladder, they trigger a lot of changing, infection and scar into the gallbladder. That's trigger the stone called mixed stone. They call either cholesterol, pigment, and calcium. So in summary, really, mostly the stone is formed by cholesterol. The second group is pigment, and the third group is mixed, causing by infection. So this is all we know about the gallstone so far.
Which group that might have high risk to get the gallstones?
In medicine, we identify the high-risk group. And usually either easy to remember, just remember 4F. F means female. The female has more stone than male, about double the risk. Second group is over 40 and mostly fat. That means and finally is have family. So we have 4F, female, fat, and over 40. Now, beside that group, we have the other group is usually when they're losing weight quickly. Most they'll be lady when they try to losing weight quickly, they run to the risk of having more stones. And the group of taking a lot of hormone like estrogen, using birth control, and using the hormone after they get to menopausal period, they run the risk of having more stone. And lastly, the group of having liver disease, especially cirrhosis, by different underlying causes, they run the risk of having more stones.
Dr. Tran, what are the symptoms of a person who have gallstone?
The symptom was really is along two groups. The first group is completely have no symptom, or they have very vague symptoms, such as they feel like they have very poor digestion. They have the problem when they eat big meals, especially when they go to a restaurant, they eat a lot of fat food or fried stuff. Then they feel like they have very troubles with the digestion, either the food stay too long in the system. And the other side of the stories is people may develop called gallstone attack. Gallstone attack means the patient suddenly having severe pain on the right upper part of the abdomen, and the come and go is very severe. And then accompanied with the fever, and sometimes people may have yellow skin, things like that. So the fever, the severe pain, including the yellow the skin, also favor the diagnosis of gallstones.
So you said that some have stone very undetected, very quiet, there's no symptom. So what happened? What are the complications if the patient have the gallstone for a long period of time without treatment? Would that danger the health of the person?
Well, the complication really in general of the gallstone is from very mild to serious, because people may develop just infection of gallbladder. It's usually easy to treat. Then secondly, they may develop obstructions of the bile duct. If you can see and remember, the bile duct is so small, and then the stone can cause complete obstructions of the bile duct and blocking the whole system. And the liver cannot release the bile to the intestine to help with the digestion of the fat food. The third group is when the stone stays too long, they may develop infection. And the infection causing the necrosis or causing damage to the gallbladder and causing ruptures of the gallbladder. Then the serious complication come, because when the infection, bacteria, the bile get into the abdominal cavity, they may trigger the whole infection of the whole abdomen. And then the patient may die from that complication. This is very serious. So therefore, in these cases, the surgeon usually they have to do very urgent surgery to try to remove the gallbladder and try to clean up the inside of the abdomen.
Dr. Tran, how do you make a diagnosis of gallstone disease?
Right now with the technology, it's not difficult to make a diagnosis. Based on the symptom, the physician may guide the patient to get the ultrasound of the gallbladder. And you can see in the pictures, ultrasound can detect the gallstone easily if the gallstone is big. Now, in difficult cases, we can use CAT scan. We can see on the X-ray. You can see the stone a little bit different because it's white and it show up easily on the CAT scan. Now, if the ultrasound cannot detect, the CAT scan cannot detect, because the stone is so small and stuck in the bile duct or some common bile duct, then we have to rely on the technology called MRI or MRCP. MRCP stands for magnetic resonance cholangiopancreography. Mean with the technology, they just focus on the pancreas, the gallbladder, the liver, and also the bile duct. Most of the time, people are able to detect the stone really causing obstruction. Now, if all these procedures cannot really bring up the reason why the patient had the problem or cannot detect the small stone, then they may have to use the technology called ERCP. ERCP is the technique to use the endoscope with a special design inside, try into the stomach, go down to the intestine, looking for the opening of the bile duct, and try to get inside, inject the dye, the contrast into the whole this system to really able to visualize the whole system of the bile duct and looking for the stone. At the same time, when they see the stone, they can use the special instrument, very tiny, to remove the stone from the bile duct without relying on the surgery, like in the old days usually we do. But now with technology like this, people can avoid completely the surgery, and they're able to see the whole thing with the new technology like this.
Let's talk about treatments. Dr. Tran, I see some patients use treatment through oral medication, and some other has to have surgeries. Would you please explain about all kind of treatments that use for gallstones?
We have two groups of people we have to deal with. The first group, they don't like surgery, and they feel like they don't have enough symptoms. They're not really bothered by the gallstones. This group, usually the physician will decide based on the information they have. If the person doesn't have much symptom, then the gallstone is really small, less than 0.5 millimeters. Then the physician may recommend the patient to really on diet and take the medication. The only medication we use right now is showing that may helpful is the Actigel or Osoriol. These medications people have to take for a long time, maybe 6 months to a year, and then follow up with the ultrasound to see whether the stone reduces in size or they have some improvement or disappear. Now, easy to see the effect of the medication by follow closely the stone by the ultrasound or the other technology. Now, but most of the cases we deal with daily, people need the surgery. From the old day until now, the old day, people had to go to surgery. The surgeon will open up the abdominal cavity, looking for the stone and remove the stone, and then remove the gallbladder and looking for the stone in the small, tiny duct and try to remove all of them. So it's one surgery usually lasts really a lot of hours. Now with the new technology on the screen, you can see right now we call laparoscopic cholecystectomy. This means they use the laparoscope, the instrument to get inside the abdominal cavity, use the light at the end to look inside, and using the different instrument by looking on the screen on the television, and they can really handle and try to remove the gallbladder. Usually very successful. The surgery really doesn't cause much complication. The patient may go home in 1 or 2 days. I think this is the laparoscopic cholecystectomy is the most commonly used nowadays in the United States and other countries as well. So this is basically that the treatment right now the most efficient using to deal with the gallstone.
Are there any new equipment for surgery with gallstone?
Really, the methods is not new, but the instruments, the surgical instrument has been updated and improved with the technology. And right now, the group of experts in China, they really redesigned the surgical instrument. By using the technology right now, they get the tiny ultrasound on the tip of the surgical instrument you can see on the screen, and use that, open up the abdominal cavity and looking for the gallstone. When they come closer to the gallbladder, they will use an ultrasound to locate how many stones in the gallbladder. They open up tiny little hole in the gallbladder and then try to remove all the stone inside. By doing that, I think they can avoid to remove the gallbladder. That means they don't need to cut off completely the gallbladder. They still able to preserve the gallbladder, just remove the stone. The benefit of that is they don't need to do a lot of instrument. They just use one instrument with different function. They can use the light at the end, they use the ultrasound, they can do the suction, they can do the removing using the same equipment. So that's the new device right now popular in China, but hopefully this will move to other countries as well. So I think that's one of the good things about the future for the technology applied to surgery of the gallbladder.
Dr. Tran, what are the complications after the patient have the surgery? What happened to the patient after they have the gallbladder being removed from their body?
Usually we have two different types of complication. The first group is right after surgery. Usually people develop pain after surgery, and they may have some kind of infection, but it's very minimal. And mostly people, they recover very well in about 1 or 2 days and then may go home. The question whether the patient without gallbladder, how they doing afterward for long term, they still able to function normally like anybody, even though without any gallbladder. Because remember, gallbladder is just the sac to store the bile. The bile is usually mainly released from the liver. So they still able to function with one condition. They need to avoid a big meal with a lot of fat stuff inside, because the liver may not able to release enough or sufficient bile to digest the big meal. So they have to limit their meals, and especially fat and fried food. And also eggs. If they eat a lot of eggs, they may need a little more bile. So this is the only thing that we need to concern about. Actually, the people are still able to have the risk of having stones. Not in gallbladder because they're already removed, but they have the stone in the bile duct. And there's so many cases, people still have obstruction from the stone developed right in the bile duct. It's not from the gallbladder. So be careful, because they remove the gallbladder doesn't guarantee that the people are never able to develop another stone. And so whenever it happens, the physician have to take a look at it again and make sure that they don't have the recurrence of the stone in different places until they come on bile duct.
Before closing the medical news show today, would you please give some advice on how to prevent having the gallstone, Dr. Tran?
I think, remember, we need to lose weight, but not so fast, because it's losing weight so fast may trigger stones. And a bit eat more vegetables, especially nuts, because the study recently showed that the small amount of nuts every day may help to reduce the numbers of the stones. Limit the use of the hormone estrogen, because especially in birth control or after menopausal, and try to limit using of some of the medication well known, particularly stone, is Lobet and Tricor. They're the only medication using to treat the high cholesterol and triglyceride. That may trigger some thing related to the stone. So basically, just keep losing weight, exercise, drinking a lot of waters. I think that's basically to prevent most of the disease, not just the gallbladder.
That is all the time we have for medical news show today. Thank you for joining us, Dr. Tran.
Thank you for watching our show today. Again, thank you, Ms. Lam.
You're welcome, sir. That was Dr. Sang Tran, who just shared with us the information on gallstone disease. We hope that the information provided by Dr. Sang Tran has shed more light on the gallstone disease. That is all the time we have for the medical news today. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the medical news. Until then, have a good one.